Those.
There we go. Go ahead, Mike.
All right. Well, hello again, everybody. It's Mike at the library. And once again, I'm joined by our director, Casey Armstrong, and former library worker and now Dr. Marcus Germany. And we're here for our third session talking about why it's important to get the coronavirus vaccine. We met in May, we met in April, and now it's the middle of June. And we're kind of approaching herd immunity with the virus, with the vaccines. Still trying to get there, still trying to convince people how important this is to get done. So Dr. Germany has been kind enough to join us the last couple of times. He's here again. So thanks for joining us, Marcus. How have you been?
I'm good, Mike. How are you?
Very good.
Good.
And
thanks for having me.
We're glad to have you once again. Dr. Germany works at Metro Health and he's studying for the boards. He will be taking the boards in a month or so he'll be totally certified as a doctor, and he's become kind of our resident expert on talking about the coronavirus vaccine and the virus itself. So, Dr. Germany, what's the latest in the medical world as far as talking about the coronavirus? I know it's kind of plateaued. I don't know if I should say plateau, but it's kind of at a point where they've stopped with the Wolstein Center. We don't have the centers like that to give out the vaccine anymore. Everybody who has had the chance that really wants to get it has been able to, and now kind of trying to outreach to more of the people that haven't been able to for whatever reason. So how's the medical world approaching this right now?
I think they're doing a lot of what we've been hoping for in the past, and that getting vaccines to neighborhood pharmacies and to clinics and to hospitals to eliminate the need for mass vaccination sites. And that more people have more options of where to go and get the vaccine instead of having just one or a few options that many neighborhood and local pharmacies and other points of contact are offering vaccines of the many varieties to patients throughout the city, the state, and throughout the country.
And has anybody you know, or Casey, anybody that you know that's been vaccinated, have they become magnetized?
Absolutely not. From my end,
no, nobody can't stick a fork onto your forehead and it stays there all day. It's stuck or nothing like that.
If it does, that's for a different reason, but it's not because of the vaccine.
Then you really need a doctor if that happens, right?
You might need a special doctor, but a very specialized and highly trained physician or surgeon, but not because of the vaccine.
Well, thank you, Dr. Germany, for dispelling that myth. I know that has been in our local news, so appreciate getting the facts out there.
Certainly.
So the Ohio Health Advisory Platform is reporting that 47.14% of Cuyahoga County's residents have completed the vaccine, which is great. So almost half. But what does this really mean? So what can those of us who have gotten vaccinated, what can we do? And also, how can we protect those who haven't gotten?
It means that 47% is darn near close to 1 out of every 2 people. So in a room of 10 people, we can just about count on 5 of them having been vaccinated. So that's wonderful. That's wonderful. That's not a good. The start was there, but it's a good push towards our original goal of 70-80% to get towards herd immunity. As far as vaccinated people, we can only just continue to share our experiences and encourage those we love to get the vaccine, so that we can get as close to the eradication as we can through herd immunity. But it's at this point, it's kind of it's on the people who have not gotten the vaccine. Those are the current targets. So other initiatives like Vaxxmillion or the widespread availability of vaccinations are targeted towards those people who are on the fence about getting the shot, not getting the shot. We want to just promote its safety, overall efficacy, and its importance to putting this entire experience behind us.
And Casey mentioned, what can the people that have got the vaccine completed, what can they do? I'm completely vaccinated. I have been since the end of March, I think, early April. So it's been a couple months. Here's my card, prove it. Anybody with computer expertise, pause real quick and steal my information. But so what, I can just run around, do whatever I want, right? I'm going to Chicago next week to watch the Indians play the Cubs. So I should have no worries about anything, right? I shouldn't take any precautions anymore for anything, right?
Well, it still varies by state, I believe. I think most recently I heard this week, or maybe it was last week, that California was starting to relax their requirements and their mandates significantly. Here in Ohio, we've been relaxed since the 2nd of June. I'm not sure what Chicago and Illinois are up to these days, but I think it is safe as long as the districts and the regions and the states allow to get back to our larger scale and kind of ways of living. Large scale concerts and sporting events are safe to go to, and masks are completely optional. They're not. I wouldn't say they're not mandatory. I wouldn't say they're discouraged upon that. They are completely optional to your own level of comfort. Speaking of the Indians, Mike, I was there yesterday.
Oh, great.
The Orioles game, and the stadium was pretty full. It was pretty full for a home game, and I was remarking to one of my friends that I didn't see one person wearing a mask.
Wow.
Not one. Not one.
So,
of course, I didn't see everyone in the stadium, but not one person was wearing a mask that I saw.
well, with your statistics that you just said, basically almost 1 in 2 of us, we can guarantee that out of the 10 people in the room, 5 of us have gotten a shot and the other 5 have not possibly gotten a shot, or maybe somewhere in the process of getting completed. So, wow. So we still need to be a little bit cautious.
Agreed. I was going to say that those relaxation of mandates and ease of restrictions are solely for people who are completely vaccinated and have completed a vaccine series. So if you're not vaccinated, unfortunately you shouldn't share in the quote unquote wealth,
right,
of the ease of mandates. And we say that because it's for the protection of people who have not been vaccinated or who have not been vaccinated yet. They are still at the most risk to contract and spread the virus. So for their safety, it is wise and highly encouraged that they wear a mask and continue to practice the social distancing and social responsibilities. Whereas the vaccinated people have been shown through all the trials to experience a significantly reduced burden of disease should they catch the virus, and they're much less likely to spread it to someone else. So it's a bittersweet discrepancy, I'll say, between those who are vaccinated and those who are not.
So
now I did see an article, and I have it on my phone right here. Came out June 11th, so toward the end of last week. And this person was interviewed at a hospital, Long Island, New York, and said everybody that's been hospitalized, not everybody, but almost everybody that was hospitalized at that time with COVID were all unvaccinated. So you can still get it if you are not vaccinated. And we've seen reports, especially from the major sports, a lot of Yankees who had all been vaccinated, they get tested still very regularly. Some NBA players, Chris Paul, who's on the Phoenix Suns that are in the Final Four, just announced that he's sidelined because of it. They're not sure if he has it, but if he's vaccinated, whatever. But you can get it if you've been vaccinated, and especially those that get tested more regularly get it, but they don't really suffer too many adverse effects from it. So you can still get it, but it probably won't really do much to you if you're vaccinated. Those that aren't vaccinated can still get it, and it probably can be a lot worse for them. So yeah, if you haven't been vaccinated, you probably should definitely still be taking those precautions. I was at the Indians game Sunday like you, Marcus, and probably a little bigger crowd. I didn't count, but just thinking probably less than 10 people were wearing masks, 10 people out of 10,000. I did not see very many people wearing masks, and I do go to the store without my mask. So I'm one of those doing that because it's been recommended. If you're vaccinated, you can do that and not worry. And you're not staying around top of people at the store anyway. It's not like I might think twice about going to maybe a sold out Cavs game where you're inside neck to neck with people, or at a concert, something like that, even being vaccinated. I might think twice about that, but an outdoor activity like the Indians, I don't, or going to a big store that you're not around top of people. With the CDC guidance, I feel fine going to a place like that. And since doing that, I haven't felt any sniffles or any symptoms of anything like a cough, a cold, anything like that. So I guess for me, it's going all right so far. So
if you do, because this is as we're going through the summer, everybody's having a great time. Dr. Germany, we're all enjoying this weather, but I'm starting to think ahead to the fall and to flu season. And so can you explain what we need to do if you are experiencing flu-like symptoms, or how do you tell as we get closer to the fall, what is the difference between the flu and COVID and what you should do?
For now, I think it's highly unlikely that you would have the flu, the influenza virus. So if you experience flu-like symptoms now, it will be a wise decision to get tested for COVID, even if you have received a vaccine or if you are going to receive the vaccine. Because like we've said in recent sessions, the vaccine is good, but it's not 100% effective. So there's a very slim chance that you could still contract the coronavirus. So I say if you think you have the flu around June, July, August, it is very unlikely that you have the flu during those months. So you should strongly consider a COVID vaccine. And as far as heading towards September, October, the fall, and the winter, I think the guidance is still to come from the experts, the CDC and those national health experts as to how to approach those symptoms as we do enter the flu season. I think getting a flu shot in this upcoming fall and winter will be just as important as it was last year, because the virus will still likely be around. In what capacity, we don't know, but the virus will likely still be around. So I think we're still awaiting some guidance as to how we approach that season, in terms of what it looks like. Because I think currently we're on the right trajectory, but that doesn't mean that we're going to stay on the right trajectory or that things could change drastically and dramatically as we get into the second half of the year.
And that gives us an opportunity, Casey, to promote that the library will be having some COVID self-test kits distribute to the public. What do we get, a couple hundred of them or more? So I'm not sure exactly when we're putting those out, but those will be very soon available for anybody that wants to come in and grab them and take them home and do your test and see how it comes out. So another important aspect of the vaccinations, and just recently they approved some of the vaccination, one of the companies or both of them, I'm not exactly sure, but for kids aged 12 to 17, I believe, under 18 for a while was not eligible for the vaccinations. They weren't sure how the effects were, but they recently allowed that. So where are we with vaccinations for children? Those ages obviously can do it, but under that age, shouldn't be doing it yet. They aren't giving those. Any updates for parents or questions parents should be asking their pediatricians?
Sure. The guidance for the Moderna and the Pfizer vaccines is that anyone 12 and older can receive either vaccine. So that's fantastic. We don't have this age discrepancy where we had it before, whereas Moderna was 18 and up and Pfizer was 16 and up. That everyone 12 and older can receive a vaccine series. I'm not sure about Johnson & Johnson or other brand names, but those two are the first two, and it's great because we can now start vaccinating our older children and adolescents in hopes that they are able to go back to school this coming fall without masks, without as stringent restrictions and distancing. And we knew that before this inclusion of the adolescents, that kids were experiencing COVID and COVID-like symptoms like the MIS-C that occurs in children and adolescents, and that they can experience severe disease, much like children who can have really, really bad bouts of the flu. They can have really, really, really bad bouts of COVID. So I think that's important to know that now that we have more people eligible for vaccinations, we should be encouraging them to get it, if not for anything, or if not for the younger children who are not yet eligible, to protect them by passive, quote unquote, immunity.
And children, I think they can get it. People say, don't worry about it with kids because they don't really get sick, but they can pass it on. Kids can get sick. You don't want kids to get sick as far as dying. You don't really see that a whole lot with the younger kids. So that's a consideration with schools reopening. You got a lot of, obviously kids under 12 all together in the same room. Many millions probably in all the schools nationwide of kids being under that age and wouldn't be able to be vaccinated. But for the most part, the numbers show that the children don't suffer like older people, adults, especially the real older people. But I know now a lot of the people really getting sick from it are more in their younger years, maybe 20 through 40, rather than older people. So as far as kids not being able to be vaccinated right now, the younger kids, is that a huge concern for schools, you think, Marcus, or is that something they can go ahead and not worry, not have concerns about it, or how should people feel about that?
I think it's kind of analogous to routine traffic vaccinations in that there are certain age classifications and age cutoffs that children can receive vaccines and children cannot receive vaccines. So it's not the first time in pediatrics and for the care of children that some children are not eligible to receive certain vaccines. Now with this one, it's a little different because it's on the newer side and the studies are still ongoing. So it is not out of the question that the guidelines can down the road further include kids who are younger than 12. So again, like we saw that older teenagers were initially included in the trials, and now we kind of included the younger teenagers and older adolescents. So it is quite possible that more studies would show that the next group of kids would be, the 8 to 11-year-old crowd could receive the vaccine. So it's a work in progress. And personally, I haven't heard of anything like that coming, but it is not unrealistic and difficult to believe that could be something that we see, especially as schools start to open.
So, Dr. Germany, you were talking earlier when we first started that you were mentioning the larger vaccination places are closed. Can you remind us again, so where can folks go and get the shot? Is it still free? What can they expect now when they go to get the shot? Do they need to make appointments?
I can't speak for the other institutions around the city, but I know for Metro Health, every patient who is an established Metro Health patient has an order for a vaccine in their electronic medical record. So all they have to do is call the Metro Health scheduling line. I don't have the number with me, but they have to call that scheduling line and get an appointment. They just have to show up at the time of their appointment. They don't have to be seen by their doctor beforehand. They don't have to make any special arrangements, but other than to call and make the appointment for the coronavirus vaccine. And some of our satellite institutions, and including main campus, are giving the vaccine at the location. So there isn't a huge stopgap or delay. So if you should have an upcoming appointment, you can call the vaccination registration line and see if you can have your shot be coincidental with the day of your appointment. And I'm sure other institutions like the Cleveland Clinic and University have similar guidelines and similar procedures in place.
Okay.
And you probably wouldn't have to wait too long now. Previously, I remember when I signed up, I had to wait more than a week for the first time. Now with those places closed, that assumes that there's not such a demand, such long lines, so you could probably get in a day or two, even that long.
And the good news is like the appointments are typically, so you don't have to wait an hour. And at least for the Metro Health system, the vaccine is free. There's no charge to our patients for that. And again, it's not just the hospitals, but pharmacies and other institutions and businesses are at least trying to make it as available as possible for the vaccines to get in people's arms.
Now, the first vaccine, I think, was given out in early December of last year. So it's been around 6 months, 14.5 million Americans, or 44.4% of our population has been vaccinated. What lessons can we learn from this so far? And what are our health professionals seeing in hospitals now?
As far as the lessons go, I think this has been what we call experiential learning, that we've learned how to somewhat prepare for the virus, how to experience it, how to experience the troughs and peaks, or the lows and the highs of the virus. We've learned how to adapt to dynamic and changing scientific guidelines and recommendations. We've learned how to pretty much alter our way of living for 15, 16 months as we experience this virus. And I think we've learned how to kind of emerge or begin to emerge from the lockdown and the shutdowns that we've had, and how to be successful on a larger scale. Yes, we've lost 600,000 Americans.
Yeah, that
to
was
this,
the number I
and
saw today.
600,000, but that number certainly is staggering and quite significant, but it could definitely be higher if we had not taking things seriously in terms of preparing for the virus as best we can, instituting and maintaining social distancing and social regulations and guidelines, and then pushing for and delivering and making available a vaccine that has proven to be very, very effective and safe and just welcomed by the scientific community, and I think as the world itself. So this has been a introduction to pandemics 101 that everyone has had to register for, no matter if you wanted to or not.
Right.
Yeah.
And the vaccine is still in the experimental phase, if you want to use the proper terminology from whoever decides, the FDA or the government, whoever decides to label those things. It's still experimental, but like we said, 14.5 million Americans received it, and then more worldwide. And as far as the experimental stuff goes, with all those people, you haven't really seen any bad side effects on a large scale from it. So I think even though it's considered experimental, it seems to be enough of a sample size to show that over 6 months, nothing really bad has happened from it.
I think 14 million is more than enough of a sample size.
Yeah.
So I try not to, I think the word experimental makes people a little uneasy and somewhat fearful. So I always say that the FDA has approved these vaccines, but they've undergone kind of like an expedited or a emergency use authorization, or an EUA, is what we see in the papers, such that it's not just someone has created a vaccine and now we're getting it. It's been tried, it's been studied, followed, and regulated, and it's just been expedited because we didn't want to just have it sitting around waiting as we lost more people and more people became sick and passed away from it. So it is approved. Is what I want to make sure everyone knows, that the FDA is following this and regulating this. And as we saw with the Johnson & Johnson kind of setback, if there are any concerns, the FDA and the CDC and the governing bodies will step in and pause if need be the vaccine. So I like to ease people's reservations about it being, in layman's terms, I guess, experimental versus authorized.
So, Dr. Jeremy, what should we do as we look ahead, as far as, I know there was some initial conversation about possible future pandemics. What do we need to continue to do as far as keeping ourselves safe and healthy?
If I never lived through another pandemic, I'd be just fine with it. I have no interest in doing this again.
I would agree. I hope it's another 100 years.
If it were more, I'd be fine with it. I'd be totally fine with it. But I think it's been a good opportunity to reiterate things that we've all learned since we were in grade school, preschool, kindergarten. Proper hygiene, proper hand washing, proper just self-care, and how not to put others at unnecessary risk, such as if you were to experience any type of upper respiratory symptom, cold, flu-like symptoms in any season, how to distance yourself, how to take care of yourself and everyone around you, especially the elderly and the those with severe chronic illness, and the importance of masks and gloves when necessary and when used properly. How to keep droplet and respiratory infections at bay.
Okay. So
we were talking a little earlier.
We still need to be washing hands, proper, when you're coughing or sneezing, proper
cough into the elbow.
Just if we are not feeling well, we are sick, stay at home. If you got that sick time, use the sick time.
And we were talking earlier about the vaccine rates, the vaccination rates, and Cuyahoga County, at the most recent report that I looked up today, is at 48%, 48 point whatever percent, and that's second in the state. and not far behind first, which I think was Franklin County. Lake County, which is right next door to us, is 11th. So then many of the other counties around us, Lorraine, Summit, are all around the top 10. So our area is probably one of the best you can be in the state as far as vaccination rates. So that's pretty good. And like people have been saying, at the bottom of the list was many of the rural counties, especially Southern Ohio. So sounds like the urban counties are the ones that are probably more equipped to deliver the vaccine, first of all.
Right.
Set up places like the Wolstein Center, so they're able to get it out to a lot more people. And those are the places where more people live. So I guess that's good. Those places are the ones that are distributing the vaccine most of all. Now, the Vaccination, I don't remember if it was announced or it hadn't been started, at least when we last met, but that's going on now. That's supposed to incentivize many people to get the vaccine. Has the medical community seen an increase since then? I remember when it first started, they said there was an increase, but at the same time, that was when they allowed the teenagers to start getting the vaccine. So there was an increase, but they said it might have been attributed to more teenagers being able to be eligible for the vaccine. So have you guys in the medical community seen the Vaccination change anything as far as vaccination habits go?
I don't know if it was all or somewhat due to the Vaccination sweepstakes, but we have seen a steady rate of people getting vaccinated. Like when I see them in the office, that's one of the questions I ask everybody nowadays is, have you been vaccinated? And if not, are you in the process to be vaccinated? And then we have our conversations as usual about, the side effects of the vaccine, what can happen, why it's important to get vaccinated. So it's become a question that I interview my adult patients and my older pediatric patients to see, to try and help them make their own decision while being informed. So we are seeing a good number of people getting vaccinated and trying to educate as best we can those who aren't vaccinated yet or who don't currently plan to be vaccinated.
Well, I thought I saw too some communities. I can't remember whether it was Brook Park or Brooklyn, but there was a few communities also giving $100 away. So you might there's the Vaccination, but you might want to see what's going on locally in your own city, because quite a few cities have initiatives. I know there's been folks giving out free beers and what was the other one? Was it ice? It might have been ice cream.
Yeah, I think the Indians were giving away discounted tickets, and there was some bars giving away a free beer. I think Krispy Kreme was doing a free donut, things like that. So I know one thing for sure, the Vaccination has inspired. I think some of those things were going on before the states started doing it, at least for Ohio. But several other states have done vaccine lotteries since Ohio.
Oh, okay.
Ohio has, I think Maryland and Oregon for sure. Have announced programs similar to Ohio's. I don't know if it's $1 million, but they've announced giveaways for things like that. So Ohio's program has at least inspired other states to try to promote it to their people. So I think, and just so everybody knows, one of us is expecting the governor to be knocking on our door shortly. We might have to cut this short. They announce it at 7:30 every Wednesday. So maybe
I didn't get my call. I got my phone right here, Mike, just in case.
Yeah, we're waiting. So if we just abruptly end, one of us might have been awarded by Governor DeWine.
Don't worry, don't call. Facebook. Don't worry, don't call me, don't write me. Just know that I am living a life that is now.
We'll call in. One of us will be calling in Rich tomorrow.
Yeah.
So as far as inspiring people to get the vaccine, I think there's been 6 winners announced so far, 3 of the million and 3 of the scholarships. I think 5 of them already had their vaccine when it started. One guy from Toledo, he works at Amazon, one of those Amazon warehouses. He said that the reason he got the vaccine was because they announced the Vaccination contest.
Really?
And mostly the reason he hadn't got it before, he said, was just the weird hours he worked. It's a demanding job. Wasn't easy for him to go somewhere to get the vaccine. He's tired, or it's just odd hours or things like that. So I think, there are a lot of people that aren't taking the vaccine for they don't believe in it, for religious reasons, whatever. But I think what the Vaccination is really trying to do is get the people like that man in Toledo just to have the opportunity to do it, or he's too exhausted on a given day. He's got kids that he has to go pick up after or before work or things like that. So
Yeah. A little more
that's the
encouragement.
real outreach that that we're trying to get to right now. The people like that want to do it, but just don't have time or the energy.
Yep. Give them a little bit of added incentive to do so.
Mhm.
So I think if the state or different communities really want to continue getting people to do it, they need to go out to them and maybe set up in the Walmart parking lot or the Amazon parking lot. Some of the biggest employers around the state, go to them where you have a lot of people working, and then they can get it right there.
Right. So Dr.
So I don't know
Germany,
if that's going to happen,
you-
but that might be a next step.
if you are one of those of us who have gotten the vaccine and you've been exposed to someone who's tested positive for coronavirus, you don't have to quarantine, right? But if you haven't had the vaccine and you've been exposed, so tell us what the difference is.
I think the difference is in the protection of the vaccine. You know, I haven't brushed up on the CDC guidelines for exposures, which is a positive thing because the rates are falling so low that I'm not sure what the latest guidelines are. But if you are not vaccinated and you have been exposed to somebody who is confirmed positive, you should, as we've been doing, take it seriously, get tested so that you know, and still quarantine based on the latest guidelines. But if you have been vaccinated, the guidelines will be a little bit different for you. If you would like to get tested, you may. I mean, there's not an automatic exclusion that you can't if you've been vaccinated. But if you are showing symptoms, like we said before, you are within your right to contact your medical provider and get vaccinated. And I was saying that the reason I haven't followed the guidelines too much is because we're just not, which is a great thing, we're just not seeing as many positives as we were. We got correspondence from Metro Health that as of Monday, a grand total of 4 inpatients were positive for coronavirus, just 4.
That's awesome.
That's great.
Down from the several hundreds that we had earlier in the pandemic. So to be in the single digits is absolutely wonderful. And none of them, I believe none of them were critically ill.
So Dr. Germany, I know that during COVID, I had a new granddaughter. And
congratulations.
Thank you. But we were not allowed, mom could only have one person in it. It was a lot of rules, which I completely understood and supported. So tell us about that. Are there still a lot of restrictions when folks go to see their healthcare provider?
The restrictions, at least at Metro Health, are still in place, but they're much more relaxed than they were in the beginning. You know, there was a point where we were allowing no visitors to come into the hospital unless certain circumstances. And now we've relaxed into, there are more and more, I guess, accessible visiting hours, and we are allowing more patients the opportunity to have visitors throughout those hours, because we realize that that part of a successful hospital stay in a timely discharge is the therapeutic effect of having visitors while in the hospital. So we've done our best to balance safety and the need for good health care during this pandemic.
Now, one thing we haven't talked about, and it's getting some headlines, are the variants. And I think the 2 major ones are the Alpha and Delta. Alpha and Delta are the 2. I forget which one is the worst version of it. It has been seen in the United States, but they say the current vaccines seem to be effective against it. What's the talk about those variants in the medical community?
Yeah, we don't really discuss it to the point of that we need to have special protocols or procedures just yet, because the vaccines are effective against the variants, and typically the routine screening or the routine tests don't routinely test for the variants. We just like to know if a person is positive or negative for some version of the virus. So yet another reason to get vaccinated, because they have shown protection and shown to be very efficacious against the original strands and the new strands, which is very reassuring. Which is very reassuring that we won't have to go through something similar like this. Hopefully, we won't have to anytime soon.
And I read somebody said that there's basically as a person that's already vaccinated, the variants would be one reason that I would be more cautious at doing things. Still, I had read, somebody said the previous strain had, you had 1.2 or something % chance of getting COVID if you're vaccinated. With the new strain, it could be up to 6%. So that's a significant difference. It's still not a huge amount. And if you're vaccinated and get it, you probably won't feel the effects as much as somebody else, but that is what I read as the difference. Say if you go to an NBA game and it's 20,000 people in there, it could be 60 people end up getting, even if they're vaccinated, could end up getting COVID from being in an arena like that. So something like that make me as a vaccinated person think twice about going to a big crowded indoor thing. But still, I think that's good news that few people could get it and not feel terrible side effects from it. So yeah, like you said, it seems the virus or the vaccine is working against the different variants of the virus, at least in the United States. I think England just extended their shutdowns another 4 weeks based on their getting hit a little bit more with the variants. So there are places that it's still running rampant, but here at least it seems that we're doing a decent job.
Yes.
Well, and that's the good thing when I see the news stories that, for all is said and done, our country, we do live in a country that is doing a great job of doing its best to protect everyone. And I know that there are countries, they're desperate for the vaccine. So we do encourage everyone to please take advantage of the opportunities that our country provides.
Lost track of what I was going to say. So
I'm sorry, Mike. I threw you off.
That's okay. It was nothing major, but at the library we've relaxed the restrictions like everybody else, and I think I would say probably about 50% of the people that come in still wear masks. So that's more than I see when I go to other places like ball games or the grocery store or other places like that. So it seems like people who use libraries are still a little bit more cautious than those that are at other places.
And we talked a little bit about children, Dr. Germany, because we're seeing a lot of young people come into the library, which is so wonderful. It just warms my heart. But I still am concerned about that younger group who isn't eligible for the vaccine yet. But I think initially they were saying that the younger group wasn't as likely to get the COVID virus. Or can you explain that again as far as children and the vaccine? And the virus.
Sure. So usually the children are more resilient to viruses. Young infants and children get them all the time. They have, they have the cough, the sneeze, the cold, the fever, and then they get over. But there's always that percentage of that portion of kids who, for whatever reason, experience severe disease. We need to be hospitalized, put on supplemental oxygen in the intensive care unit. So and you can't predict who needs the additional care. So it's good that all of the adults and those who are eligible get vaccinated to protect those kids, and it's good that they still practice what they were doing before and keeping their mask on and being diligent. The parents, at least, being diligent about keeping them safe and washing their hands and having good hygiene as best they can. We know kids are constantly into things and putting random things in their mouth, but it's good for parents to be as diligent as they can, and that starts with them being vaccinated themselves.
Now, Dr. Germany, would you say when people come to you for their consultations and they aren't vaccinated and you have that talk, do you find them convinced to go get the vaccination? How often does that happen?
I'm never sure what convinces a person to get vaccinated or what, just dissuades them from getting vaccinated. But the choice is in their hands. I just want to make sure that they are making an informed choice. They have the best information and the best tools to make the decision for them. Again, I don't treat anyone differently, and I think that's true for the entire medical profession. Someone who's vaccinated versus someone who's not vaccinated, they all receive the same care, the best care that we can provide. I can't force anyone to do anything medically, but I want to make sure whatever they decide, that they are educated and empowered to make the decision that's best for them.
Sure. And I'll be in Chicago with some people that I know aren't vaccinated. They're still my friends and they're not dummies, so they make their decision with, I know they have the proper amount of information.
Right.
So, yeah.
Well, it doesn't look like, guys, unfortunately, we don't have any audience questions to share this evening, but I don't, Mike, do you have any final thoughts or questions, or Dr. Germany, you have any final thoughts you want to share before we wrap it up for the evening?
Not really. I'm just appreciative of Marcus being able to join us these last couple of times, and he's been an excellent wealth of information. I think if I didn't have my own reading of what the things are going on, preparation, then you would have given me plenty to think about as far as the vaccination goes.
Certainly. I thank you for giving me this platform to speak to the region and the patients of Northeast Ohio about the virus and the vaccine, and how we can ultimately come out of this successful as we can.
And Dr. Germany, I think you've got a second career in public speaking and informing people on topics such as this.
Before we go, Marcus, do you mind the class of 2021 Euclid just graduated? They walked across the stage for the first time at this new stadium behind the high school. It was just beautiful being able to see them walk behind the library and all the beautiful caps and gowns. So any advice for your fellow new alum as they make this next step in their lives?
I think I'd tell everyone that at any junction of your life, only you can make the decision about which way to go. You can take the easy, the well-traveled route that leads nowhere. It's a shorter path, where you can take the leap of faith and take the longer route that includes more challenges, but at the end you'll be more successful, and I'm sure you'll be glad you took the route where you had to work a little bit harder. So to all of the graduates this year, including myself, congratulations.
Yep.
Congratulations that we made it through some very challenging periods in our lives. And if we can make it through this, then the sky is the limit for everyone.
I forgot to say congratulations to you as well. Congratulations, Marcus.
Thank you.
Well, I think that's pretty much everything that we have to discuss tonight. So in the next 15 minutes or so, make sure you answer all those unknown calls on your cell phone. It's probably either a car warranty or the governor giving you $1 million. So after that, for the next week or so, you don't have to answer it if it's unknown. So thanks for joining us, Casey and Dr. Germany, and the last couple times as well. So looking forward to seeing where things go in the next few months.
Perfect. Good night. Thank you.
Good night.
Bye,
you all
everybody.
take care. All righty.